So hi guys and welcome to Wemcast. I'm here today with colleague and friend Emma Slator. Today what I want to do is do a little bit of a deep dive into her experiences as a newly or relatively newly qualified paramedic within London in the middle of this pandemic. But what I'll do is hand over to her to introduce herself and her background.
Yeah, hi Owen. Thanks for having me along today. Came as a bit of a shock the other day, but it's nice to be asked along for this. Yeah, so I'm Emma. I'm a paramedic based in London, where I've been for the last 2.5 years, since I qualified with a Bachelor of Science degree, based out of the Surrey area. Prior to that, I did some experience working as a healthcare assistant in the hospital as well. So that's sort of my medical background so far.
Brilliant, brilliant, Emma. That's fantastic. That's fantastic. So I understand you work in the very same station as I do in Westminster. So I guess you get a real cross section of work from Westminster and the roundabout area. But how many years have you been working in London for?
So it's 2.5 years now, yeah. So mostly in Westminster in that time. So
Yeah, Spencer. So just to really bring it into some of the sort of contemporary sort of climate that we're working in, because I'd like to delve a little bit into your background and your experiences recently, but just explain to people exactly what's happening right now, because quite uniquely, just as we were talking right then, you've now been crewed up with a firefighter. Is that right? So we're running a very different model at the moment.
yeah, so actually I start on these extra sort of ambulances as of tomorrow that they have put out to deal with the pandemic. So that'll be involved with pairing up with a firefighter. So I start that tomorrow. Probably will get a firefighter in a couple of weeks to help deal with everything. But this is where they've taken firefighters that are already blue light trained and just trained them up to sort of assist us on the road as paramedics, just to increase the manning and deal with everything that was really a struggle a couple of weeks ago when we saw the call rate absolutely soaring in London.
Yeah, yeah, fantastic, fantastic, Emma. And what's your thoughts on that from a clinical perspective? Because I think actually it'd be fantastic to have them along, and they'll learn a whole new skill set, and we'll hopefully learn from them. As far as clinical support is concerned, I'm guessing you've got access to the clinical support desk. But would you normally bounce ideas around with the crewmates, and will that change the dynamic slightly? Do you think?
Yeah, I think it's very interesting because you often will fall back on your crewmate and they have a little bit of an understanding about what's going on and they can support you much more easily than somebody who's only had sort of a short amount of training. But part of part of the reason I wanted to do this was to sort of take me outside of that comfort zone and give me a little bit of a different experience. And all the firefighters I've met so far have been really keen on doing this process. You know, they're all people that volunteered to do it, and it's just a fantastic thing to have that working relationship because firefighters aren't people that we often see out and about and work with, not as much as we do with the police. So I think it's a really interesting dynamic actually, and I'm looking forward to it.
Yeah, that'd be fantastic. That'd be fantastic. Like I said, a lot more collaborative working, which should be great, because you'll get to see both the inside working of how of their mentality, but also hopefully like you can impart some information both ways, which is fantastic actually, Emma. So just a broader question, Emma, would be how's it been over the past few weeks for you?
Yeah, so a few weeks ago, as I say, when the call rate soared and we didn't really have the manning in place, and there obviously was a lot of staff off sick, either isolating because of their families or housemates, or they had symptoms themselves. It was a real struggle. You know, we were going job to job to job as we normally do, but also knowing that there was lots of calls waiting. So it was quite difficult to work in that environment, really. Fortunately, with the extra manning that's been brought out, things have changed slightly. We're getting a little bit of time to sort of decompress, which is great news because it's definitely something we need. Had it have kept up as it was a few weeks ago, I think there would have been a lot of people really struggling with that. So yeah, it's really positive at the moment, actually, for me anyway.
Yeah, fantastic, fantastic. So yeah, absolutely, and I could really feel it. I felt for my colleagues and for the ambulance service that we work for, because actually it's such a difficult dynamic for the leaders and managers of the ambulance service, because you've got a whole cadre of staff that are off they're off sick, making it really difficult to staff and man ambulances. You know, up to at some point sort of 30-40% off sick, which is really difficult actually. So I think it's been a
Yeah.
real difficult time for the leaders and managers as well, which I can sort of empathize with really. But just from your perspective, Emma, sort of looking at when it was really busy, did you what were the intricacies of trying to navigate that from sort of wearing PPE? Because having worn PPE myself, it's really difficult to communicate, to infer sort of information, have conversations on scene. How did you sort of navigate that as that started to come in?
So I think obviously there was quite a change over a period of time where maybe we weren't wearing PPE initially to all the jobs, and then it became that we were wearing it regularly. Um, I think I've noticed mainly how much we do actually rely on our facial expression and sort of lip reading, especially with the elderly population. So I found myself on jobs sort of having to actually just take my mask down from my PPE to communicate with these people because actually you're trying to say something really important, but they're not understanding, and how else are you supposed to do that? So it's been quite tricky in terms of that. I had one particular family where one of the family members was deaf but could lip read very well, and they were all under quite a lot of stress, really worried about their family member. And I just found myself surrounded by family that all had coronavirus, COVID symptoms, and couldn't taste or smell anything. But there I was pulling down my mask to make sure I had that conversation with the family member and ensure that she was reassured about the situation. So, putting yourself at risk, but making sure that they do fully understand what's going on. So yeah, but also just putting on the PPE, every job, it gets a bit tiresome, but it needs to be done.
Yeah, absolutely, absolutely. I totally agree with you. Actually, very, very quite tiresome, but necessary. And like you've just inferred, actually, there, Emma. The commonalities of symptoms. What we're generally finding is the absence of taste and or smell seems to be quite sensitive signs and symptoms to COVID-19. Now, some of that's anecdotal, some of that's in the literature, but actually, it seems to be very much my experience that people that I've been treating do have an absence of taste and smell, and that seems to be sort of pointing to the disease. But so I know we were talking earlier about the fact you've only been to one or two couple of cardiac arrests where it's been potentially COVID-19. Um, but just about that cardiac arrest, because there was something interesting you said, which I think is worth picking up on. I believe they had underlying pathology or underlying comorbidities. Is that right?
Yeah, so they had COPD, or chronic obstructive pulmonary disease, which I believe probably caused the cardiac arrest. And unfortunately, the patient hadn't wanted to go to hospital earlier to get this treated due to some previous experiences, and probably also his fear of COVID. Um, but yeah, because it's a respiratory disease, we had to treat it as possible COVID, and then that made obviously the family interaction quite difficult because at that point you have to stop anybody obviously seeing their family member that's now deceased. So it was really really difficult situation, and I'm sure that our colleagues are experiencing that widely, which I think will be one of the main things that causes problems further down the line for our colleagues.
Yeah, Emma, that seems to be a commonality. A couple of things there. Just one is that have you experienced a real fear of going to hospital? Because I've certainly been to quite a few cardiac arrests where the patients should have probably they refused to go to hospital, but should have probably gone to hospital when we got to them earlier in the day or the day before, because that's when they needed to. That's when we could have caught them and caught their symptoms. But have you seen a real fear and almost um, sort of reluctance to go to A&E?
Yeah, definitely. A lot of people we're meeting were saying you really should go to hospital with this, and they are refusing. I haven't necessarily met anybody that is in immediate danger that's refused. But I think it's also very noticeable in the A&E departments that they're so much emptier than they usually would be, because a lot of people are just treating or dealing with their symptoms at home where they would normally actually go into hospital with those things. So It is a very interesting dynamic to be working in. I think maybe part of the reason our call rate had increased as well might be because people would rather be checked over as per se at home rather than going into hospital and putting themselves or their family members at risk. Um,
Yeah, indeed. And so, just something else that you said before we touch on another point is, I think something which we were speaking about earlier around we're seeing quite a lot of underlying respiratory comorbidities being affected by this pathology as an exacerbation. So COPD, asthma, and other underlying respiratory diseases that can actually be almost pronounced or indeed exacerbated by COVID-19, and that's certainly my experience from treating a whole card array of cardiac arrests in the past couple of weeks. So it's interesting that the patient you attended had those symptoms. But just from a personal perspective, Emma, have you how have you dealt with? Has it been a fearful experience? Have you? Did you get a semblance of fear from colleagues and/or yourself and/or family going into this pandemic, or have you been quite stoic and just accepting, or how have you navigated your emotions in that way?
Yeah, I think generally there is a state of fear. I think especially a few weeks ago there was. I think I've brought comfort to myself in that I should have probably had it by now because I've met so many people with symptoms of it. So maybe I've already had it mildly, and therefore I think now I'm not really worried anymore. Maybe it's a false sense of security, but it's something. So I'm quite happy with that. But yeah, family is definitely worried, and I can tell my colleagues are definitely worried as well. Um, yeah, especially a few weeks ago, there was a real heightened sense of worry. But now things have been put in place to sort of triage patients a little bit more. We're actually meeting less people with sort of mild coronavirus symptoms, which is making it easier to manage as well. I think knowing that we're not exposing ourselves as much as we were a few weeks ago. So I feel like the sense of fear has gone down a little bit. It has subsided, especially with myself anyway.
Yeah, good. Yeah,
Yeah.
good. Have you seen a prevalence of or rise in mental health at all in the community or in your experience clinically?
Um, Yeah, one case particularly sticks out where a patient seemed to have a new onset of psychosis. She's never experienced anything like that before, and just being in lockdown for a couple of weeks in her flat and being under stress and not sleeping, just meant she was talking complete gobbledygook, out of nowhere, really. So that was definitely one that stuck out to me. But I think there will be more to come, especially as the lockdown is extended, especially people that are lonely and isolated on their own. I think we're getting more calls to elderly people that might normally call us quite a lot anyway, but now even more because they've got nobody to see. So it's quite tricky.
Yeah, absolutely. So something you mentioned earlier, Emma, about demand pattern and about the demand profile at the moment versus a couple of weeks ago, because like you said, very difficult situation a couple of weeks ago, a lot of staff off, high call rates. Now the call rate seems to have dropped off. It's how does that look to you? Because I saw you the other day and we had about
Yeah.
7 or 8 ambulances on station, which was bizarre to see.
Yeah, so I think everything they've done up in the control room to manage calls has been really fantastic. So the call rate has gone down, whether that be due to those measures or the amount of media going out as to only call us in an emergency. And then obviously we've increased the manning as well, and I imagine that the staff levels have gone back up as people have become better as well. Um, but yeah, it does make such a change to have that downtime with our colleagues, be able to sort of interact with each other, and as I say, decompress. It's just been a really nice period in a way to be able to do that, especially after it seemed like it was just going to be um, awful for a long period of time based on what we were experiencing a few weeks ago. Um, but yeah, so it's quite fortunate that it's gone that way because I think otherwise we'd all be really struggling.
Yeah, absolutely. I think, like you said, cognitive and psychologically, it's nice to have a community of staff with you, so you can, like you said, decompress and talk to each other, which is absolutely fantastic. So, do you think that? So, am I right in the understanding that you've got this new line with the firefighter for just a couple of months, and then it's going to be under review?
Yeah, so I think it's going to continue until sort of July, but then at that point they'll see how we're managing really, and see what sort of state the country as a whole is in, and then decide going forward whether it's still required. So yeah, it'll be interesting to see where things go in the next few weeks, definitely.
Yeah, absolutely, absolutely. And have you seen other colleagues in hospital and or nurses, doctors, or other sort of allied health professionals under duress at this time? Have you sort of felt the pinch when transferring patients into hospitals, into different EDs?
Yeah, definitely. I think there's a lot of stress in the hospitals. You know, we're in a really fortunate position that we still only go to one patient at a time. I've always found us really fortunate in that. You know, we're always a lot less under a lot less stress than A&E departments, even at normal times. And I've especially noticed the struggles that they're having with the lack of staffing as well. So you know that they're short staffed, and they're dealing with even more than they would normally be. Um, I think that our control room must be feeling that as well, or they were a few weeks ago, much more than we were. We can only sort of do one at a time, and that's the best we can do. So we're quite lucky. But yeah, A&E colleagues have been quite stressed. I think I've heard other people saying that they've seen nurses crying, and you know that sort of situation, and definitely seeing the fear on them as well. I think it's been quite nice how they've been looking out for us as well, though. When we've been going in there, you know, I've had doctors asking me, you know, are you guys okay? How are you getting on out there? And it's just really lovely. Like the cooperation between us all has been quite nice to see.
Yeah, that's fantastic, Emma. That's fantastic. And what's some of the wider collaboration and support that you've been noticing, just either from industry, from the community, from shops and or businesses? Have you sort of felt supported from that angle as well?
Yeah, so one thing I've noticed is the police have been absolutely fantastic, making donations to hospitals or to ambulance stations, and just generally, you know, being a smiley, happy presence, and turning up to, because I think their call rate's gone down as well. So they'll stop if they see us driving on blue lights to a job, and they'll be like, "Oh, do you need help or anything?" Which has been really lovely. But yeah, the wider community, you know, we're getting regular donations from a local hotel to the ambulance station of food, which is just fantastic. And even when this all first started, and Costa, oh, sorry, I should probably shouldn't say, coffee shops were making, you know, allowing us to have free drinks, etc. It only lasted for a few days, but it was a real boost when it was really busy. Um, and just, you know, members of the public stopping and saying hello and thank you so much. And it's a nice change. I mean, our work hasn't changed a huge amount to normal, I wouldn't say. You know, we're still going patient to patient, and that side of things hasn't changed a lot. But to have that appreciation was just really a boost to what is quite difficult. You know, patient interactions, not allowing people to come to hospital with us, and you know, family members, etc. It has made the job more difficult in that way. So actually having that extra appreciation has been really helpful.
That's
Um,
fantastic. Yeah, absolutely, absolutely, Emma, absolutely. And so, have you felt the pinch of social isolation, Emma? I mean, I know you're in a house with a couple of other. Is it, I understand. Are they paramedics as
Yeah,
well,
so
or are
I'm
they?
really lucky. I'm with 3 other paramedics, so I at least get to see people and socialise, and then obviously at work I get to see people as well. So um, I think quite fortunate in a way that I can still go to work, not like other people that are out of work, and just, you know, stuck in their households, etc. We've got a garden here, so we're fortunate to have that in central London. But yeah, it's not been too bad actually for me, so that's good.
Good, good. And so, are you aware of any colleagues that might have suffered from COVID-19 as well? 'Cause talking to some of my doctor colleagues, there's some pretty bad cases, some critical care cases, some not so bad cases, but certainly it's definitely affected a whole cadre of healthcare professionals. Has it affected any of your colleagues at all? Do you know anyone who's been affected by COVID-19?
Yeah, I've definitely only heard of mild symptoms so far, or you know, mild in terms of what other people are experiencing. I think mainly because a lot of our colleagues at Westminster are quite young. Then maybe we've come off quite lightly. And as I said earlier about my false sense of security with thinking I must have already had it, that's actually been proven wrong in the last few days by somebody else becoming unwell with mild symptoms who had the same sort of thought. But yeah, there's been quite a few people that have had mild symptoms, or a lot of people walking around saying, I didn't have anything other than a lack of sense of taste or smell, and that they've probably had it, but haven't been tested for it, so you can't prove it. But yeah, it's definitely pretty prevalent, I think.
Yeah, indeed. And I think we're probably going to see a ramping up of testing over the just on a whole sort of population level, not just a healthcare level, but yeah, a whole population level over the next few weeks and months, which will be, useful both to me and to you and to everyone else as a litmus test and a gauge of who might have had it, who might not have had it. But just coming back to an earlier point, actually, Emma, around around something you said, which I find really interesting. You said, communicating with family members and or colleagues, you didn't realize how much you depend on non-verbal communication. And so I came to that revelation absolutely myself, having dealt with a lot of cardiac arrests over the past couple of weeks, and having to interact with colleagues, make some very difficult decisions, and having the absence of that non-verbal communication is really tricky. But the most tricky thing I think I've had to experience is again that translation of breaking bad news to family with PPE on, which is really difficult. Have you found it difficult communicating on the radio and or sort of trying to communicate with others with PPE on? How have you navigated? Have you navigated trying to even get to your car keys and or ambulance keys and things under your PPE? Has that been a challenge?
Yeah, I think the main one is just not being able to use your own phone. To be honest, if you want to call a GP or something, you're stuck in your PPE, and what you're supposed to do, you have to go and take everything off to just go and call a GP. So that's been quite difficult. Um, uh, um, but yeah, I think I just never realized how much, like you say, non-verbal communication is important, and you just have to find workarounds for it. And because we're not used to it, I suppose it's quite difficult. One thing that sticks out actually is quite a while ago, before this pandemic, we put on all our PPE for somebody who we were querying Ebola in. Way after the Ebola crisis, but we were still querying it, and wearing our full face respirators like we used to have. Um, and calling Chubb with that on, and they said it sounded like we were in a bucket, and we were like, well, we almost are in a bucket, really. So I think trying to talk in the PPE on the radio is probably quite difficult for our colleagues up in control to understand more than anything. Yeah.
Absolutely, and there's subtle differences. Absolutely. So listen, that's absolutely fantastic, Emma. So just a couple of things I wanted to ask before before we finish up. One is if just as a community of practice, so we have lots of paramedics, doctors, nurses that will listen and or watch this. Is there a message of encouragement you'd like to give to them through this difficult time, and through this last difficult few weeks?
Yeah, so I think I'd just like to say that well done to everybody for such a fantastic effort that you're all putting in, and just keep supporting each other. You don't realise how far some words of encouragement, or asking if somebody is okay, really goes. I think it can make a real difference to somebody's day. So just keep doing what we're doing. Really, I think we're all pushing really hard, and it is scary and it is worrying, but we can get through this together. Um, and we just, yeah, keep going.
Yeah, absolutely, Emma, absolutely. And just another question really around self care, really, because one lovely thing that you did for me, you did or didn't realize it, was the other day when we were both on shift, you came and sort of shoved a bowl of stir fry in front of my face, which was really appreciated. I think we were both on night. I certainly was on night shift. But that presence of both self care and care for others, just around you, it meant the world to me. But actually, from a self care perspective, is there anything you would advocate in this time, just for you, for indeed for yourself or for others that need to orchestrate self care?
Yeah, I mean, that particular day, so I was staying in a hotel a couple of weeks ago to keep me in work. So I just walked into work to come and have some social interaction and have something that wasn't a takeaway. So it made sense for me to share it around where I could. But yeah, self care, I think, is quite important to de-stress and try and do something different. You know, I've been playing a lot of Xbox, which is probably not the best thing, but I'm definitely going to start getting into some more sort of home workouts, home yoga, that sort of thing. I think there's a lot of apps available for free at the moment to do those things and to guide those sort of exercises. I think exercise and eating well are definitely the most important things. Hence why I sort of took myself out for a walk and cooked some real food that particular week. Um, yeah.
That's fantastic, Emma. Fantastic. So, just one final question, really, Emma, would be what's next for you? I know you've taken this line with a firefighter now, so you'll be matched up with the firefighter for a month or two, well, a couple of months. Um, any plans to progress as a paramedic? Any thoughts, or are you just going to stick with it at the moment at Westminster? What's in store for you?
Yeah, so after this firefighter line, I think I'll be going on to a first response unit car, which I've been quite worried about for a while. I think anybody that's not worried is perhaps a bit complacent. So I think it's good to be worried. But I think this firefighter line will definitely help me with that. You know, having somebody with me but still being completely clinically responsible will just give me a little bit of comfort knowing actually I can do it. So that's the next step after this. Beyond that, I've not really thought much further about what I want to do. I'm quite happy doing what I'm doing. So yeah, we'll see where it takes me in the future, I think.
Emma, that's fantastic. Listen, thanks for your time today and your perspectives. We really value it and value just your honest recital. So, yeah, Emma, thanks for your time.
No, that's all right. Thank you.